What did people do when they had a fever, a wound getting infected, or pain that would not stop, and no physician, no pharmacy, no hospital existed? They used plants. Not because they believed in plants, because plants were the only thing between them and death. And over thousands of years, they documented, through survival itself, exactly which ones worked. Today, I am walking you through 20 of them, used in wars, epidemics, and expeditions where nothing else existed, and confirmed by modern science to have been doing exactly what the people who used them observed. Starting with a plant whose compound a country doctor described correctly in 1785, and that cardiologists still prescribe today for the same reason. And number 3 is a Nobel Prize-winning discovery, pulled from a manuscript written 1,700 years ago. Stick around because number 4 was distributed by the British government during the London Blitz, specifically as medicine for anxiety under bombardment. Number 1. Foxglove, digitalis purpurea, whose cardiac glycosides were described with clinical precision by English physician William Withering in 1785 after observing a folk healer's remedy for dropsy, whose digitalis compounds are still prescribed by cardiologists today for heart failure and atrial fibrillation, and whose mechanism of action Withering correctly identified from clinical observation alone 2 centuries before the molecular biology to explain it existed. In 1775, William Withering encountered a woman in Shropshire, England, who was successfully treating patients with dropsy, severe fluid accumulation from heart failure, using a complex herbal preparation. He identified foxglove as the active ingredient, spent 10 years conducting what were essentially clinical trials on over 200 patients, and published his findings in 1785 in a document called An Account of the Foxglove. He described the indications, the dosing, the toxic effects of too much, and the clinical signs of effective treatment with a precision that modern cardiologists recognize as accurate. The cardiac glycosides in foxglove, digitoxin and digoxin, inhibit the sodium-potassium ATPase pump in cardiac muscle cells, increasing intracellular calcium and strengthening the force of cardiac contractions while slowing the heart rate. Digoxin is still prescribed today for heart failure and atrial fibrillation through precisely the mechanism Withering had identified from observation alone. The folk healer whose remedy Withering investigated had been using this plant for years before he arrived. She did not know the mechanism, she knew the outcome, and she was correct in every clinical detail that mattered. Modern cardiology has been prescribing the same plant compound for the same conditions through the same mechanism for 240 years. Number 2 requires understanding a scene from 1971. A Chinese scientist named Tu Yu is working in secret in a military research program during the Cultural Revolution. She is looking for a malaria treatment because drug-resistant malaria is killing soldiers. She has exhausted modern pharmaceutical options. She turns to ancient Chinese medical texts, and in a manuscript written in 340 CE, over 1600 years earlier, she finds a specific preparation instruction that changes everything. Number 2. Artemisia annua, sweet wormwood, whose artemisinin compound was discovered by Tu Yu in 1971 from a 1,700-year-old Chinese medical manuscript describing a preparation for intermittent fevers, earning her the Nobel Prize in Physiology or Medicine in 2015, and representing the most direct line between an ancient botanical text and a modern pharmaceutical Nobel Prize in history. The Zhouhe Beijifang, a handbook of emergency medicine written by Geihong in approximately 340 CE, contained a specific instruction for using Artemisia annua against intermittent fevers. The instruction specified that the plant should be soaked in cold water and the juice expressed and consumed, not boiled. Tu Yu recognized that this preparation instruction was significant. Boiling destroys artemisinin. The ancient author had empirically identified the correct preparation method for maximizing the active compound without ever knowing the compound existed. Tu Yu extracted artemisinin and tested it against Plasmodium falciparum, the malaria parasite. In 1972, it worked. It worked against drug-resistant strains. It worked through a mechanism, generation of reactive oxygen species that destroy the parasite's cellular integrity, that was entirely distinct from existing anti-malarials and that drug resistance could not easily circumvent. Artemisinin-based combination therapies became the global standard for malaria treatment. The WHO estimates they have saved millions of lives. Tu Yu received the Nobel Prize in 2015. She has said consistently that the discovery belonged to traditional Chinese medicine, that she merely found what had been recorded in a manuscript for 17 centuries and confirmed what ancient physicians had observed without the tools to explain. Number 3. Willow bark, Salix alba, whose salicin compound was described by Hippocrates around 400 BCE for pain and fever, used continuously across Greek, Roman, medieval European, and Native American medicine for 2,300 years. Before salicin was isolated in 1828 and chemically modified into acetyl salicylic acid, aspirin, in 1897, making it the oldest documented effective medicine in Western history. Hippocrates prescribed willow bark tea for pain and fever around 400 BCE. He was not the first. Egyptian medical papyri from centuries earlier describe willow preparations for similar applications. The Romans used it. Medieval European herbalists prescribed it. Native American peoples across multiple tribes used indigenous willow species for pain, fever, and inflammation, independently of any European influence. The continuous 2,300-year record of willow bark use for exactly the conditions that aspirin treats is one of the most remarkable examples of accurate empirical medicine in human history. Salicin, the active compound, was isolated by Johann Buchner in 1828. Further research identified that salicin is metabolized in the body to salicylic acid, which is the actual therapeutically active compound. Chemical modification of salicylic acid to reduce its gastric irritation produced acetyl salicylic acid, aspirin, which was introduced commercially by Bayer in 1897. The mechanism involves inhibition of cyclooxygenase enzymes, COX-1 and COX-2, that produce prostaglandins involved in pain, fever, and inflammation signaling. Hippocrates was working with the correct plant for the correct conditions through the correct biological mechanism 2,300 years before any of that mechanism was understood. The aspirin in every medicine cabinet on Earth is the pharmaceutical refinement of what he prescribed. Number 4. Valeriana officinalis. Distributed by the British government to civilians during the London Blitz in World War II, specifically for anxiety management under bombardment, with valerianic acid and isovaleric acid confirmed to modulate GABA-A receptors through the same system targeted by pharmaceutical anxiolytics, and documented use for anxiety and sleep dating back to ancient Greece and Rome. During the German bombing campaign against London from 1940 to 1941, the British government distributed valerian preparations to civilians experiencing anxiety under sustained aerial bombardment. This was not a gesture toward natural medicine. It was a practical decision by a government that needed to maintain civilian psychological function during a prolonged crisis, and that recognized valerian as the most available and effective anxiolytic preparation accessible at scale. The decision reflected 2,000 years of consistent use. Galen prescribed valerian for insomnia in the 2nd century CE. Medieval European herbalists used it for nervous conditions. The 18th century saw it widely prescribed for what was then called nervous exhaustion. The pharmacological basis for this consistent historical use was confirmed when researchers identified that valerianic acid in valerian root modulates GABA-A receptors, the same receptor system targeted by benzodiazepine anti-anxiety medications. GABA-A modulation increases inhibitory neurotransmission, reducing neurological excitation and producing anxiolytic and sedative effects. The British civilians sheltering in underground stations during the Blitz who received valerian preparations were receiving a compound that worked through the same receptor system as diazepam, a drug that would not be synthesized for another 20 years. What the government distributed from necessity, modern pharmacology has confirmed by mechanism. Number 5. Cinchona bark, the source of quinine, brought to Europe from Peru in the 1630s and used to treat malaria across colonial empires for 300 years, saving the lives of soldiers, missionaries, and administrators across Africa and Asia, where malaria was the primary cause of European mortality, and whose legacy includes the invention of gin and tonic as a palatable quinine delivery system for British troops in India. Malaria killed more European colonizers than any weapon or competing empire. The Jesuit priests who encountered Peruvian indigenous use of cinchona bark in the 1630s and brought it back to Europe introduced what became the first effective treatment for the most lethal infectious disease affecting European expansion. Quinine, isolated from cinchona bark in 1820, kills Plasmodium parasites by accumulating in the parasite's digestive vacuole, interfering with the detoxification of heme, a byproduct of the parasite's digestion of hemoglobin. Heme accumulation becomes toxic to the parasite. The British Army in India was consuming such large quantities of quinine-containing tonic water for malaria prevention that soldiers mixed it with gin to make it palatable. And gin and tonic became one of the most consumed beverages in British colonial history as a direct consequence of malaria prevention pharmacology. The cinchona tree's bark saved enough European lives in colonial Africa and Asia that it arguably determined the geographic outcomes of several colonial enterprises. It remains pharmacologically active today. Quinine is still used for drug-resistant malaria and for nocturnal leg cramps in some clinical contexts. A Peruvian indigenous remedy observed by Jesuit missionaries in 1630 became the pharmacological foundation of 3 centuries of European global expansion. Number 6. Elderberry, Sambucus nigra, with historical records suggesting communities using elderberry preparations during the 1918 influenza pandemic experienced lower mortality, containing flavonoids with confirmed neuraminidase inhibition through the same mechanism as Tamiflu, and used continuously across European folk medicine for influenza, fever, and respiratory infections for centuries before the influenza virus was identified. The 1918 influenza pandemic killed between 50 and 100 million people, more than died in World War I. Medical options were essentially non-existent. Physicians could treat symptoms but had no antiviral agents and no understanding of the viral mechanism they were trying to address. Accounts from the period include references to communities using elderberry syrup preparations during the pandemic, with outcomes that suggested some protective effect. Accounts that are difficult to verify rigorously given the data collection limitations of the period, but that are consistent with what we now know about elderberry's antiviral mechanism. The flavonoids in elderberry, particularly cyanidin-3-glucoside and cyanidin-3-sambubioside, inhibit neuraminidase, the enzyme that influenza viruses use to release newly formed viral particles from infected cells. This is the same mechanism as oseltamivir, Tamiflu, the primary pharmaceutical antiviral for influenza that costs over $100 per treatment course. Multiple meta-analyses of randomized controlled trials have confirmed that elderberry supplementation significantly reduces influenza duration and severity. Victorian households made elderberry syrup every autumn specifically for winter influenza. The preparation that European folk medicine used for respiratory illness for centuries was doing, through a mechanism that took until the 21st century to identify, exactly what the people who made it observed that it did. Number 7. Mullein, Verbascum thapsus, used by Native American peoples across multiple tribes for respiratory conditions, adopted by European colonizers for the same applications, and prescribed by American physicians in the 19th century for tuberculosis before any pharmaceutical treatment existed, with saponins and mucilage confirmed to support respiratory mucus clearance and reduce bronchial inflammation. Tuberculosis killed approximately 1 in 7 of all people who ever lived. Before streptomycin was discovered in 1943, physicians had essentially no pharmacological treatment for it. They could prescribe rest, fresh air, good nutrition, and hope. In this context, the use of mullein for tubercular coughs and respiratory conditions by both Native American healers and 19th century American physicians represented one of the few available palliative interventions for a disease that was killing a significant proportion of the population. Mullein leaves contain saponins that thin bronchial mucus, making it easier to clear from the respiratory tract. Mucilage compounds coat and soothe inflamed bronchial membranes, reducing the irritation that drives chronic coughing. Verbascoside and other phenylpropanoid compounds have confirmed anti-inflammatory and antiviral activity. The plant does not cure tuberculosis. Nothing available before 1943 cured tuberculosis. But it addressed the most debilitating symptoms of the disease: the chronic productive cough, the bronchial inflammation, the respiratory distress, in ways that modern respiratory pharmacology recognizes as mechanistically sound. The giant fuzzy leaves that grow in every disturbed soil environment across North America were the respiratory medicine of a world that had no other option for its most lethal disease. If this history is making you think seriously about having some of these plants available at home, Not just knowing their history, but knowing how to actually prepare and use them, there is a complete practical guide in the first pinned comment below. Everything you need to grow, prepare, and use the most effective medicinal plants at home, with step-by-step protocols. The knowledge that saved lives for centuries becomes real when you have the system to apply it. Link is pinned below. Number 8. Opium poppy, Papaver somniferum, used for pain management in surgical contexts from ancient Egypt through the Napoleonic Wars and the American Civil War, whose morphine compound isolated in 1804 became and remains the pharmaceutical standard for severe pain management, and whose continuous use across 4,000 years of human conflict represents the longest documented effective analgesic in history. The Ebers Papyrus from approximately 1550 BCE describes opium preparations for pain relief. Sumerian clay tablets from 3400 BCE reference the poppy plant in contexts suggesting medicinal use. Greek and Roman physicians prescribed it. Arab physicians of the medieval Islamic Golden Age refined its preparation and documented its applications with extraordinary precision. European surgeons of the Napoleonic era used laudanum, opium and alcohol, for the pain of battlefield amputations. American Civil War physicians on both sides administered it for the same purpose. Morphine, isolated from opium in 1804 by Friedrich Zerturner, was the first active compound ever isolated from a plant and identified as the source of the plant's therapeutic effect. It acts on mu-opioid receptors in the central nervous system, reducing pain perception and producing analgesia. It remains the pharmaceutical standard for severe pain in surgery, trauma, cancer, and end-of-life care today. The poppy that Egyptian physicians were using for pain in 1550 BCE contains the same compound that anesthesiologists use in operating rooms right now, acting on the same receptors through the same mechanism. 4,000 years of documented human use, and the mechanism has not changed because the biology has not changed. Number 9. Garlic, Ida allium sativum, used as the primary antiseptic wound treatment by Allied forces in World War I when pharmaceutical antiseptics ran short. Documented in military medical records as reducing wound infection rates when applied directly to battlefield injuries, with a licensed antimicrobial mechanism explaining why it worked against the Staphylococcus and Streptococcus species responsible for the wound infections that killed more soldiers than combat. More soldiers died of wound infections in World War I than died of direct combat injuries in many campaigns. The Western Front trenches created infection conditions of extraordinary severity: contaminated soil, inadequate sanitation, delayed medical treatment, and wounds that allowed Clostridium, Staphylococcus, and Streptococcus species to establish deep tissue infections before any treatment could be applied. When pharmaceutical antiseptics, iodine, carbolic acid, ran short, Allied medical units turned to garlic juice. Military medical records from the period document its use and describe outcomes that suggested genuine antiseptic effectiveness. The mechanism we now understand. Allicin, produced when garlic is crushed, reacts irreversibly with thiol-containing enzymes in bacterial cells, permanently disabling the enzymatic machinery that bacteria need to survive and replicate. This mechanism operates against the gram-positive organisms responsible for most wound infections: Staphylococcus aureus, Streptococcus pyogenes, Clostridium perfringens, the bacterium responsible for the gas gangrene that was amputating and killing thousands of soldiers. The Egyptian army had been given garlic rations while building the pyramids for exactly the same reasons that British medical officers were packing it into wounds in 1917. Not because anyone understood allicin, but because everyone who had used it consistently had observed that it worked. Number 10. St. John's wort, Hypericum perforatum, used by Crusader knights for battlefield wound healing and nerve damage in the 12th century. Prescribed continuously for melancholy and nervous conditions across European medicine for 500 years, with hypericin and hyperforin confirmed to inhibit serotonin, dopamine, and norepinephrine reuptake, a mechanism comparable to modern antidepressants, in multiple randomized controlled trials. The Knights of St. John, the Hospitallers, used Hypericum perforatum for wound treatment during the Crusades, particularly for the nerve damage and deep tissue injuries that edged weapons produced. The plant's common name reflects this association. The yellow flowers that bleed red when crushed, from the hypericin pigment, were interpreted through the medieval doctrine of signatures as indicating the plant's purpose for bloody wounds. The wound healing application was real. The antimicrobial and anti-inflammatory compounds in St. John's wort have confirmed activity for topical wound care. But the application that most interests modern researchers is the one that European herbalists had been prescribing for centuries for what they called melancholy, the application that became one of the most studied herbal interventions in the history of clinical research. Hypericin and hyperforin inhibit the reuptake of serotonin, dopamine, and norepinephrine, the same neurotransmitters targeted by modern antidepressants, including SSRIs and SNRIs. Multiple randomized controlled trials and their meta-analyses have confirmed that St. John's wort significantly outperforms placebo for mild to moderate depression, with effect sizes comparable to pharmaceutical antidepressants. The melancholy that medieval European physicians had been treating with this plant for 500 years before any randomized controlled trial existed was responding to a genuine pharmacological intervention through a mechanism that psychiatry would not identify until the 20th century. Number 11. Golden seal, Hydrastis canadensis, called the antibiotic of the forest, by Native American healers of the eastern woodlands. With berberine's biofilm disruption and direct antimicrobial activity explaining the consistent outcomes that frontier physicians documented. The Cherokee, Iroquois, and other eastern woodlands, peoples used golden seal root for infected wounds, eye infections, digestive conditions, and skin diseases. European settlers who learned these applications from Native American healers adopted golden seal as one of the most important medicines of frontier American medicine. The eclectic physicians of the 19th century, who incorporated Native American botanical knowledge into their practice, prescribed it more than almost any other plant. The consistent clinical observation across both Native American and 19th century American medical use was that golden seal reduced infection in conditions where infection was present and soothed inflamed mucous membranes in the respiratory and digestive tracts. Berberine, the yellow alkaloid that gives golden seal its characteristic color, provides the pharmacological explanation. It disrupts bacterial biofilm formation in multiple species, including MRSA and H. pylori. It has direct antibacterial activity against gram-positive and gram-negative organisms. It inhibits the adhesion of H. pylori to gastric epithelial cells, reducing the bacterium's ability to establish the infections that cause gastric ulcers. The frontier physicians who prescribed it for stomach infections were addressing H. pylori infections without knowing H. pylori existed. The outcome they observed was the same outcome that modern gastroenterology research has now confirmed through mechanism. Number 12. Licorice root, Glycyrrhiza glabra, found in the tomb of Tutankhamun among the most valued burial provisions. Listed in the Ebers Papyrus for cough and respiratory conditions, used continuously across Egyptian, Assyrian, Greek, Roman, Chinese, and Ayurvedic medicine for 4,000 years. With glycyrrhizin's antiviral activity against herpes simplex, hepatitis, and respiratory viruses confirming what 4 millennia of consistent clinical observation had established. Archaeologists found licorice root in the tomb of Tutankhamun, prepared for his use in the afterlife, suggesting it was considered valuable enough to bring beyond death. The Ebers Papyrus lists it for respiratory conditions and cough. Theophrastus described it in the 3rd century BCE. Dioscorides included it in De Materia Medica in the 1st century CE. Traditional Chinese medicine has used it continuously for over 4,000 years. Ayurvedic medicine employs it across multiple therapeutic categories. The consistency across cultures that had no contact with each other, all identifying the same plant for overlapping applications, is the kind of convergent evidence that modern pharmacology takes seriously. Glycyrrhizin, the primary active compound, has confirmed antiviral activity against herpes simplex viruses 1 and 2, hepatitis C virus, respiratory syncytial virus, and in laboratory research, SARS-related coronaviruses. The mechanism involves interference with viral replication and disruption of viral envelope formation. The anti-inflammatory effects from glycyrrhizin's structural similarity to corticosteroids explain its consistent use for inflammatory respiratory conditions. The root found in a pharaoh's tomb was medicine that 4,000 years of human observation had correctly identified as effective, and that modern antiviral research has confirmed works through genuine molecular mechanisms. Number 13. Echinacea. Echinacea purpurea and related species. the most widely used medicinal plant among Native American peoples of the Great Plains, documented by European explorers as used by at least 180 tribes for more applications than any other single plant. Adopted by 19th century American medicine, and confirmed in meta-analyses of clinical trials to reduce upper respiratory infection incidence and duration. When European explorers and physicians began documenting Native American medical practices in the 18th and 19th centuries, echinacea emerged as the single most widely used plant medicine, documented across at least 180 tribes for applications including wound infection, snakebite, toothache, sore throat, colds, and general immune support. The consistency of its immune-related applications across tribes with no contact with each other represents some of the strongest convergent ethnobotanical evidence available for any medicinal plant. The alkylamides in echinacea root and aerial parts bind to CB2 cannabinoid receptors on immune cells, activating signaling pathways that enhance phagocytosis, increase natural killer cell activity, and modulate cytokine production. This is a specific receptor-mediated mechanism, not vague immune stimulation, confirmed in laboratory research. Meta-analyses of clinical trials have found significant reduction in cold incidence and duration with echinacea use. 180 tribes across the North American Great Plains did not independently arrive at the same plant for immune support by coincidence. They arrived at it through the same process that clinical research uses, observation of outcomes in treated individuals over time. And they reached the same conclusion that meta-analyses of randomized controlled trials have now confirmed. Number 14. Aloe vera, Aloe barbadensis Miller, documented in the Ebers Papyrus carried by Alexander the Great's army specifically for wound care during his campaigns. Used by Cleopatra as a skin preparation, listed in Arabic, Chinese, Indian, and European medical texts across 3,000 years, with asamanin polysaccharides confirmed to accelerate wound healing and activate macrophages in clinical trials. The story that Alexander the Great conquered the island of Socotra in the Arabian Sea specifically to secure its aloe plantations for his army's wound care is historically documented. The island was the primary aloe source for the ancient world, and Alexander needed it for his campaigns. Whether entirely accurate in every detail, the account reflects a genuine historical valuation. Aloe was considered essential military medicine for a conquering army, covering thousands of miles of difficult terrain in conditions that made wound infection routine. The Ebers Papyrus describes it. Dioscorides prescribed it, Arabic physicians valued it, Chinese medicine incorporated it, European herbalists used it continuously. The asamanin polysaccharide in aloe vera gel activates macrophages in damaged tissue, triggering the immune response at the site of injury, and has been confirmed in clinical trials to accelerate wound healing in burns, surgical wounds, and skin conditions. Gibberellin in the gel stimulates collagen synthesis, which is why modern dermatology uses aloe in post-procedure wound care. The plant that Alexander the Great reportedly captured an island to secure for his army's wound treatment is doing what every medical tradition that used it for 3,000 years observed that it did. And clinical trials have confirmed it compound by compound. Number 15. Turmeric, Curcuma longa, used in Ayurvedic medicine for at least 4,000 years as the primary anti-inflammatory and wound healing preparation. Applied to battlefield wounds across the Indian subcontinent, with curcumin's inhibition of NF-κB inflammatory signaling confirmed in research as one of the most studied natural anti-inflammatory compounds in existence. Turmeric's golden color stains everything it touches, the hands of the healers who used it, the bandages it was applied to, the cooking vessels it seasoned. That staining quality made its use easy to document historically, and the documentation is consistent across 4,000 years of Ayurvedic medical texts. Applied as a paste to wounds, consumed in milk for internal inflammation, used as a gargle for throat infections. Turmeric appears in virtually every therapeutic category in the Ayurvedic system for conditions that involve inflammation. Curcumin, like the primary bioactive compound, inhibits NF-κB, the master transcription factor that drives the inflammatory cascade responsible for the redness, swelling, heat, and tissue damage of inflammatory conditions. NF-κB inhibition also reduces the inflammatory environment that many pathogens exploit to establish infections in tissue. Research has confirmed curcumin's anti-inflammatory effects in arthritis, inflammatory bowel disease, and metabolic syndrome. The challenge with curcumin is bioavailability. It is poorly absorbed from the gut without the piperine and black pepper, which traditional Ayurvedic preparations typically included. The traditional formulation was correct. The ancient physicians who combined turmeric with black pepper in their preparations were solving the bioavailability problem without any knowledge of bioavailability as a concept. Number 16. Calendula officinalis, used by Confederate and Union physicians alike on Civil War battlefields when pharmaceutical wound treatments were exhausted, carried by soldiers specifically in their personal medical kits, with triterpenoid compounds confirmed to accelerate wound healing, and demonstrated activity against the Staphylococcus and Streptococcus species responsible for the battlefield wound infections that killed more soldiers than bullets. The American Civil War produced wound infection mortality rates that are almost incomprehensible from a modern perspective. Abdominal wounds were nearly always fatal from peritonitis. Limb wounds routinely progressed to gas gangrene, requiring amputation. The wound infection death toll exceeded combat death tolls in many campaigns. In this context, the soldiers and field physicians who used calendula preparations were working with what the herbal tradition had documented as effective for wounds, and doing so in conditions where pharmaceutical alternatives were frequently unavailable. Military medical records from the period include references to calendula use for wound care. The faradiol ester triterpenoids in calendula flowers have confirmed anti-inflammatory activity through cyclooxygenase inhibition. Allantoin promotes cell proliferation for tissue repair. Antimicrobial compounds in calendula flowers demonstrate activity against Staphylococcus aureus and Streptococcus species, the primary organisms responsible for the wound infections that were killing soldiers. Clinical trials published in the 21st century have confirmed that calendula preparations significantly accelerate healing in burns and surgical wounds compared to standard care. The flower that field surgeons applied to wounds in 1863 was doing genuine pharmacological work on the organisms that were killing patients, work that clinical trials would not confirm for another 150 years. Number 17. Clove, Syzygium aromaticum, used by colonial-era dentists for tooth pain when surgical anesthesia did not exist, traded along ancient spice routes at prices comparable to precious metals specifically for its analgesic and antiseptic applications, with eugenol still used in clinical dental formulations today for the same applications that drove its price to equal gold in medieval spice markets. Before the development of surgical anesthesia in 1846, dental pain was managed through whatever pharmacological means were available, and clove oil was the most reliable and widely available dental analgesic in the pre-anesthetic world. Colonial-era dentists applied it directly to exposed nerve tissue. Patients carried it themselves for emergency self-treatment. The price of cloves in medieval European markets, where they had to be transported from the Molucca Islands across thousands of miles of dangerous trade routes, reflected their medical value, not merely their culinary use. Eugenol, the primary compound in clove oil, binds to TRPV1 vanilloid receptors in sensory neurons, initially activating and then desensitizing them, producing local analgesia. It also inhibits prostaglandin synthesis through COX enzyme inhibition, reducing the inflammatory pain signaling at the site of application. Eugenol remains in active clinical use in dentistry today. Zinc oxide eugenol cement is used in tooth restoration. Eugenol is applied directly to exposed pulp tissue during dental procedures, and root canal sealers contain it for its antimicrobial and anesthetic properties. The compound that medieval traders crossed oceans to transport at prices equivalent to gold is the compound that dentists use in clinical formulations right now, for the same applications, through the same mechanisms, in the same anatomical location. Number 18. Plantain and Plantago major, called white man's footprint by Native Americans because it appeared wherever European settlers established themselves, used independently by European and Native American medicine for wound care and respiratory conditions, with aucubin and allantoin confirmed in a 2015 clinical trial to outperform standard pharmaceutical treatment on second-degree burns. The name white man's footprint is one of the more historically precise botanical nicknames. Plantago major arrived in the Americas with European colonizers, spread rapidly in disturbed soil environments wherever settlements were established, and was recognized by Native Americans as a new plant that followed the newcomers everywhere. What neither the Native Americans nor the European colonizers knew is that they had been using different species of the same genus for the same medical applications on different continents. Plantago major in Europe, Plantago rugelli and related species in North America, converging independently on the same plant family for wound care, respiratory conditions, and anti-inflammatory applications through observation of clinical outcomes. Opium and allantoin, the primary active compounds, are activated when leaf cells are broken, releasing them in bioavailable form. Opium has confirmed anti-inflammatory activity. Allantoin promotes cell proliferation essential for tissue repair. A 2015 clinical trial found that plantain ointment significantly outperformed standard pharmaceutical wound treatment on second-degree burns, a result that received essentially no attention in Western medical media because the compound cannot be patented and no commercial entity is positioned to invest in its development. The weed in every lawn that both European and Native American medicine independently identified as wound medicine has been confirmed in a clinical trial to outperform the pharmaceutical standard it is compared against. Number 19. Ginger, Zingiber officinale, carried by European naval expeditions from the 15th century onward as the primary remedy for the nausea and digestive distress of extended sea voyages. Used in every major maritime culture from Portugal to China for the same applications, with gingerols confirmed in clinical trials to reduce nausea comparably to pharmaceutical antiemetics across chemotherapy, pregnancy, and post-surgical conditions. Extended ocean voyages produced nausea, digestive distress, and vomiting in sailors that were debilitating enough to affect ship function. The Portuguese, Spanish, Dutch, English, and Chinese maritime traditions all independently carried ginger as the standard remedy, a convergence across cultures with no contact during their periods of maritime expansion that reflects genuine clinical effectiveness observed independently across different populations. Ginger's antiemetic mechanism involves multiple simultaneous targets. Gingerols and shogols modulate serotonin receptors in the gastrointestinal tract, reducing the receptor activation that triggers nausea signaling. They also have activity at 5-HT3 receptors, the same receptors targeted by ondansetron, one of the primary pharmaceutical antiemetics used for chemotherapy-induced nausea. Clinical trials have found ginger supplementation reduces nausea severity in chemotherapy patients, pregnant women with morning sickness, and post-surgical patients with outcomes that compare favorably to pharmaceutical alternatives. The sailors of the Portuguese Age of Discovery who carried ginger for seasickness were carrying a compound that acts on serotonin receptors through the same general pathway as pharmaceutical antiemetics that would not exist for another 400 years. The sea routes that connected the world were navigated partly on the antiemetic chemistry of a root. Number 20. Yarrow, Achillea millefolium, named for Achilles who, according to classical tradition, used it to staunch the wounds of his soldiers at Troy. Used as field wound medicine by armies on every inhabited continent across documented history, and confirming through its dual mechanism of hemostatic platelet aggregation promotion and antimicrobial activity, the principle that runs through every plant on this list. The knowledge that saved lives for thousands of years was accurate. It simply preceded the science to explain why. The Latin name Achillea millefolium carries 2,000 years of military medical history in its etymology. Achilles used it at Troy. Roman legions carried it on campaigns. Native American warriors used it on the North American plains. Zulu warriors used related Achillea species in southern Africa. Mongolian armies used it in the Eurasian steppes. No plant has a more geographically diverse and consistently documented record as field wound medicine than yarrow. And the record is consistent because the mechanism is real. Achilletin promotes platelet aggregation, accelerating the clotting cascade that stops bleeding. This hemostatic activity has been confirmed in controlled research. Simultaneously, antimicrobial compounds in yarrow, camphor, borneol, cineole, and various flavonoids inhibit the bacterial growth that would otherwise colonize the wound once bleeding stops. The 2018 University of Thrace study found yarrow essential oil activity against MRSA comparable to vancomycin. The plant closes a wound and prevents the infection that follows in a single application. Every army that carried it, on every continent, across thousands of years of human conflict, was correct. They were working without any pharmacology, without any microbiology, without any understanding of clotting cascades or bacterial pathogens. They had observation. Careful, repeated, life-or-death observation of what happened when yarrow was applied to wounds and what happened when it was not. And they were right. The science that explains why they were right arrived 2,000 years after the observation that proved it. 20 plants, each one with a history that predates modern medicine by centuries or millennia. Each one used in situations of genuine necessity. Wars, epidemics, expeditions, conditions where no alternative existed, and the plant was the only option available. And each one confirmed by modern research to have been doing exactly what the people who used them observed. The knowledge was not wrong. It was not superstition. It was not coincidence. It was the accumulated result of careful human observation, conducted under the most rigorous possible conditions. Conditions where the outcome of using the wrong plant was death. The science that has spent the last 200 years explaining these plants did not discover that they worked. It discovered why they worked. The working was already known. Hit the like button if this changed how you see the history of medicine. Drop a comment and tell me which plant surprised you most. Subscribe and ring the bell. I will see you in the next one.